Okay, so here are some steps in ethical decision making. It's a 6-step process, and it can be used in individual decision making, but very often we're going to see bioethical committees when it's a very complex situation. The first thing you might have to do is clarify the ethical dilemma. What is the dilemma? For example, you're working with another nurse, and that nurse is always offering to medicate your patients. But when you come back, your patients aren't from break or whatever, your patients aren't out of pain. And you suspect that this nurse is using drugs. You need to clarify that that's a dilemma. I think Ryan's on drugs, but I'm not sure what to do about it. Then you gather additional information. Maybe you document specific incidents. You read more about how to spot an impaired nurse. You watch his practice a little bit more and you identify options. Maybe I'll confront Ryan. Maybe I'll go to my nurse manager. Maybe I'll report him to the board. Maybe I'll try and catch him in the act. Maybe I'll just ignore it and I don't let him medicate my patients anymore. So those might be all the options open to you, and some of them might be more ethical than others. You're going to make a decision, and it might be a difficult decision, and you decide you're going to go to your nurse manager with your concerns. Deciding that next prompts action. You have to actually do it. Um, and then after the fact, you should evaluate the outcome of that decision. Maybe the outcome of that decision is that your nurse manager um, really didn't take your concerns seriously. Maybe your nurse manager is really good friends with Ryan and won't believe you. So now you need to go back to the original step and clarify your new ethical dilemma. I think Ryan's using drugs. I think the nurse manager is enabling it. And I think he's hurting patients. Gather some more additional information. Who's the next person I go to? What is the process? Is there a corporate compliance office that I can turn to? And you're going to identify some more options. Make another decision. Then you're going to act on that decision, and then you're going to evaluate the outcome. Sometimes we never get to know the outcome. Um, so, when we do, we use that information to inform other decisions. Dilemmas resulting from personal value systems. So, values are learned beliefs that help people choose among difficult alternatives, even when there may not be a good choice. So, our personal values might include loyalty to friends, might include kindness, might include nonviolence. Professional values are shared beliefs that we all have. So in nursing, our primary value is that we care about the patient and the patient comes first. So if your personal value is that you are loyal to friends and you know that your friend Ryan is impaired and his practice is unsafe to patients, your professional ethics have to outweigh those personal ethics because your primary duty is to your patient and to your professional code in that situation. Okay. So there are also dilemmas that result from institutional factors. So unsafe staffing, for example, a nurse might feel that you're not giving good enough care. You have too many patients and not enough support. And so you feel like you personally are not giving good quality care, but there are institutional factors that prevent you from doing so. Next, we have an unjust or punitive culture where you work in a setting that punishes workers for error, which means everybody hides when they make a mistake. And then we can't identify the underlying systems process that's really causing the error in the first place. When you work for a just culture, you're welcome to come forward. You put in a verge report, and instead of blaming the individuals, the committees or the agencies that kind of work within the hospital or the healthcare agency review that information and say what could be done differently to prevent this from happening again. And then the last one that I included here was healthcare practices that create structural bias. For example, a nurse works in a setting where uninsured or underinsured clients receive different types of care. Maybe they get unskilled residents where private paying patients or patients with private insurance get doctors with more experience. Those are all dilemmas that might result from institutional factors where a nurse feels a little bit powerless. You are not powerless. You are, you have agency, and there are mechanisms, and we will discuss those when we start talking a little bit more about quality improvement. But dilemmas involving peers and other professionals, we've already discussed an impaired nurse scenario. Um, we all have to cooperate and collaborate. Conflicts can and do arise. People might think that a course of action, they might disagree with a provider on the safety of that course of action, but we still have to maintain civil and professional behaviors. And we may meet healthcare workers who fail to meet the standards of care. Maybe they don't uphold sterile technique, and we notice that they contaminate the field and they just keep on going. We might meet providers who are incompetent, who just don't have the knowledge, skills, and attitudes that are necessary for competent and safe practice. You might encounter colleagues who are impaired by drugs, alcohol, or a physical or a mental health issue that renders them unsafe to patients. Or you might see people who are just plain unethical. They chart things that were never done. They, outright lie to providers about things or to nurse managers about things, or they show bias towards different types of patients. You might encounter that in practice. Um, and so, you have to uphold your professional values rather than maybe your loyalties to individuals or your need to be a people pleaser. Um, Last thing we're going to discuss are some contemporary issues. Immigration and migration sometimes cause dilemmas. Exclusion from a third-party payer system. You have undocumented um, residents of the country. They can only access care in acute crisis or on a charity care basis. There's not a lot of primary preventative care. And if we work in a system like that, we might see people coming in with really advanced healthcare conditions that could have been prevented or managed with better access to care. So we need to advocate for them. Communication or language barriers. All the time you see people, they use family members or they just don't communicate with their patients, or they try to speak English just louder. Um, so we need to be aware that that's unethical behavior. We're failing to communicate with our patients, and that limits their autonomy. If they don't know what's going on, they can't speak up. And the last ethical issue that comes up, this is more of a profession-wide issue, is when we recruit nurses, when wealthier countries recruit nurses, you have what's called a brain drain, and it exacerbates shortages in other countries. For example, Malawi is a country in Africa that put a lot of money into the nursing education workforce, and they tried to get more nurses. As soon as the nurses got their degrees, they went to the United States to practice, um, leaving them in the same situation. So that's like sort of an injustice that happens on a systems wide level. Um, and then, documentation of competency. When you have nurses whose primary language is not English, we have to make sure that they can communicate. We have to welcome them and make sure that they acclimate to the culture and that they can be culturally sensitive to the populations we serve here. Some more dilemmas. Substance use. Substance use is very widespread in this country. Right now, we're in the midst of an opioid epidemic, and we just legalized marijuana in most states, and it's created a bigger issue. Um, it's important as a nurse to remember that substance use disorder is a disease. The person is not intentionally doing this. It becomes a matter of requirement, not choice. It's not a defect of character. Nurses might see values conflict because the people who suffer from SUD sometimes have behaviors that we find hard to relate to or reconcile, particularly in the area of pregnant women or parents who might neglect their children because of their use, but also just in the behaviors of people who abuse the healthcare system. They can be somewhat manipulative of healthcare workers, the quote unquote drug seekers. Legalization of marijuana has opened up a whole new area of ethical dilemmas. For example, medical marijuana is now acceptable, but if you're a professional healthcare worker, could it lead to impairment? And could it cause you to test positive on a drug screen? And what should be the policies regarding that? And then lastly, impaired professionals of all kinds. Um, Substance use does lead to impaired professionals. Some specialties that have higher incidences include anesthesia and the emergency department. Some of that is related to stress. Some of it is related to easier access, because in an emergency, you need to be able to access all kinds of medications. But no professional is immune to substance use. Anyone can suffer from it. It's important that although we protect our patients and keep them safe, that we extend compassion to professionals who are sick and suffering. It doesn't mean they should be allowed to practice until they're in recovery, but we should understand that it is a disease, and try not to judge them, just base our actions on patient safety. Social media also has created potential areas of conflicts. I know of several cases where nurses have posted things work-related that were of varying degrees of inappropriateness. Some of them were grossly inappropriate. So, there is a social media policy statement put out by the American Nurses Association. I encourage you to read it. I am sure you have been counseled in this program many times. But think about things. What would you do if a colleague you are following on social media posts something about a patient? You're not supposed to do it. Do you unfriend them? I mean, go back to those 6 dilemmas. Do you report them? What if they share something super personal about their home life? Is it appropriate to share that with others? They've posted it on social media. Does that give you the right to, kind of disclose that with people they may or may not be linked to? Or you have a colleague on your unit who posted pictures while on vacation, and it looked like they were engaged in some behavior that might not meet Florence Nightingale's strict standards. What do you do about it? And there are ways to sort of navigate that. And I think we're almost at the end. I'm going to talk about data access and patient privacy. So, there's been a push to electronic health records. They do make things safer. They do make records more legible and accessible. But with that accessibility, there is the ability for someone to inappropriately access information through a computer system, someone who is unauthorized. And there are safeguards, but they're never perfect. And somebody who's really good with computers can find ways. So you as a nurse need to know, never give your password to anybody. Always log out of your account when you are away from your computer. If you have to walk away for a second and you don't want to lose your place, minimize your screen. Just like we never leave charts around the desk with, open charts with access to things that people should not see. Also watch, when you have electronic documentation, you want to make sure that you are not taking anything home with you to chart on later. Like, it really doesn't apply to most bedside nurses, but people who work in like case management or utilization review sometimes take patient records home. Do not do that. It's risking patient safety. All right, we are at the quiz part, and I'm going to keep rambling. These questions are similar to what you might see on an exam. So, question 1. During a disaster, nurses use a tagging system to classify the severity of injuries. Patients who are not expected to live get a black tag. Patients whose injuries are most severe get a red tag. Nurses don't treat the black tag patients because it uses limited resources that could be used to save more people. This decision is an application of which moral theory? And you have your 4 choices there. They're all normative ethics. Take a guess. I'll give you a few more seconds. And the big reveal is C, utilitarianism. That means that an action is right or wrong because it brings about the greatest good for the greatest number of people. It's not deontology. That means if the motives are good, the action is good. It's not principalism. You're not looking at the black tag patient thinking of non-maleficence. It's not a virtue. You're just making a decision based on utilitarianism. Question 2. How is Gilligans' theory of moral development suited to nursing? A, it emphasizes moral decision-making in the context of caring relationships. B, it describes moral reasoning in the context of internalized virtues as reflections of character. C, it prioritizes justice over care. D, it is concerned with higher principles to guide moral decision-making. Think it over. Correct answer is A. Gilligan's theory explores the development of moral reasoning, particularly for girls and women, in the context of caring relationships and mediating the conflict between self and your responsibility to other people. It does not explore broad principles. It is more concerned with care than with justice, not the other way around. So read it carefully. It is not primarily concerned with the development of specific virtues. That's more descriptive of virtue ethics. Okay. Question 3. Provision 5 is concerned with the nurse's duty to self and others. This is where you would have your little bookmark. What is the best example of a nurse upholding this provision? A nurse who works to promote health care for incarcerated women at risk for health disparities. B, a nurse who maintains good health with meditation and yoga after a stressful shift. Or C, a nurse who mentors other nurses. And lastly, D, a nurse who serves on quality improvement committees. Take out that bookmark. Self and others. Self and others. All right, correct option is B. A nurse who maintains good health with meditation and yoga after a stressful shift is using the same health promotion strategies to maintain physical and mental health. This upholds duty to the self. The other options are about other provisions of the code, but it's important to know that self-care is important. Start today. It helps us perform better in the practice setting, and it protects you from fatigue and burnout. You will live to fight another day. Question number 4. Oh my, this slide got a little wacky when I transferred it over to Google, and I was hoping to avoid that. But you can see it, and I'll fix it on the slideshow. The nurse is caring for a patient who is using heroin while pregnant and is experiencing moral distress because he or she believes patient's behavior is harming the fetus. Which of the following can help her resolve the conflict? A, remembering that autonomy means patient has a right to do what she thinks is best. B, adopting the Code of Ethics Provision 1 and respecting the patient regardless of her behaviors. C, applying a deontological framework to recognize that the patient's intentions are good, even if the outcome is poor. D, spending more time with other patients because utilitarianism dictates the nurse has to do the greatest good for the greatest number of people. Okay. I'm going to give you a second to read those choices. I'm thinking that maybe you can narrow it down to 2 that look a little bit applicable, and then pick the one that you think is the most appropriate. The correct option is actually B. According to the ANA Code of Ethics Provision 1, the nurse must have compassion and respect and treat people, give her the access to the care that she needs for that individual, regardless of her choices with which you do not agree. That doesn't mean that the nurse agrees with the patient, condones the drug use. In terms of autonomy, the patient probably doesn't think this is best. It's really not a conscious decision. It's born out of disease and addiction. It's a symptom of her illness. We're not going to adopt utilitarianism. All patients need you. Every single one is worthy of dignity and respect. And if this patient makes your assignment so heavy that you can't give care to everyone, you need to talk to your charge nurse and find a way to equalize it so that you can give all of your patients what they need. All right. Moving on. Oh, that's all I had. I guess we're done. All right, folks. I know this was a long segment. I know this was a lot. You did a great job on your early nurse leader presentations. I'm really super proud of you.